How do you correctly use an inhaler spacer for your child? Using an inhaler spacer correctly can make a big difference in how well your child's medication works. It helps deliver medicine straight to the lungs and reduces side effects in the mouth and throat. Let's walk through the steps to do it properly. First, prepare the inhaler and spacer. Remove the cap from the inhaler and check that the spacer is empty. Shake the inhaler well, usually 4 or 5 times, to mix the medication evenly. Insert the inhaler's mouthpiece firmly into the open end of the spacer, making sure it points upright. Next, position your child comfortably. For older children using a spacer with a mouthpiece, have them sit or stand with their head in a neutral or slightly tilted back position. For younger children or infants, use a spacer with a mask that fits snugly over their nose and mouth to create a good seal. When ready to give the medication, if using a mouthpiece, place it between your child's teeth and ask them to close their lips tightly around it without blocking the opening with their tongue. If using a mask, hold it gently but firmly over their nose and mouth to prevent air leaks. Then, press down on the inhaler canister once to releases a puff of medicine into the spacer. Your child should breathe in slowly and deeply through their mouth for about 3 to 5 seconds. After inhaling, ask them to hold their breath for up to 10 seconds if they can, then breathe out normally. If using a mask, keep it in place and allow your child to breathe normally in and out for about 6 breaths to ensure they get the full dose. If your child needs more than 1 puff, wait about 1 to 3 minutes before repeating the process. Remember to shake the inhaler again before each puff. After finishing, replace the cap on the inhaler and clean the spacer regularly following the manufacturer's instructions. Do not wipe the inside of the spacer with a cloth, as this can cause static that makes the medicine stick and reduces effectiveness. Instead, let it air dry. It's recommended to replace the spacer about once a year or sooner if it becomes damaged. Always follow the specific instructions that come with your child's inhaler and spacer, as different devices may have slight differences. It's a good idea to ask your healthcare provider, nurse, or pharmacist to show you the correct technique and answer any questions. Label inhalers if your child uses more than one to avoid confusion. Using a spacer helps your child breathe in medication more effectively by holding the medicine in a chamber, making it easier for them to inhale slowly and properly. Proper use also minimizes medication deposits in the mouth and throat, reducing side effects and making sure more medicine reaches the lungs. Remember, always consult your child's healthcare team for personalized advice and guidance to ensure the best care.